Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are with Dr. Daniel Grace, who is a pre-hospital GP, expedition doctor. He works at the Brecon Beacons, which are rugged mountains in a beautiful part of Wales. Daniel, welcome to the program.
Thanks so much, Aebhric. Great to be here, and also great to meet you a few weeks ago in Malta.
Yeah, just a fortnight ago at the conference.
Yeah, a fantastic conference as well. It was really nice to speak at that and meet so many like-minded people and get an idea of what the college is all about as well.
Good. We'll dive into that, but first, tell us a bit about yourself and what's keeping you busy.
Yeah, so as you said in that introduction, my background is as a GP. I've been a GP since 2017, but I suppose since then I've always sort of followed a slightly unconventional route in that I didn't want to see myself working in the four walls of a room in a GP surgery and then reaching retirement and then sort of looking around and wondering what happened. So I was always looking for other things to do, and I discovered sort of expedition and remote medicine fairly late on. Now seems that students and everyone relatively early on in their careers are kind of getting into it. But I actually finished my GP training, and it was then that I sort of started to take stock and evaluate things and discovered sort of expedition and things like that. So as you say, based in the Brecon Beacons now, so I'm involved with the local mountain rescue team. I also do some pre-hospital work with MedServe Wales, who are our local basics organisation. So that's with the Welsh Ambulance Service. And I just started a job in the local A&E as well. So yeah, keeping nice and busy, and that's all domestically. And then I'm always on the lookout for interesting jobs or opportunities overseas as well. So yeah, it's like spinning lots of plates, but I think that's the best way to have it.
Nice. So what did get you interested in expedition medicine? You said you went through med school and then you went through your training and you hadn't stumbled upon it. What got you into it?
Yeah, so I think, it sounds a bit cliche, but I was always, as I progressed through med school and all the specialties, there was nothing that sort of grabbed me as such. And I think that's how I ended up in general practice, because it's a nice generalist, the clue's in the name. You get to see tiny babies, old people, everyone in between. And that was fine, but I was also I was still missing something. And I went on a wilderness medicine course. And I think when I did that, I sort of was like, oh, hang on, this is all the people that I've been missing. These are all the people like me. Who also kind of have that unconventional idea perhaps of practicing medicine outside of a hospital or outside of an ambulance or outside of a GP surgery. And I think then I sort of had almost an epiphany. I was like, oh, actually, this is something that I want to try and make part of my career. The difficulty with that is balancing it with having a normal job, which is, I guess, why I don't really have one. I sort of juggle lots of different roles because as you well know, you sort of need to be able to flex and sort of change dynamically to take opportunities, and that can be hard if you've got a normal a normal employer, if you like. But yeah, I think I got into it because I've had that sort of interest in the outdoors since a young age. That's partly why I moved to the Brecon Beacons as well, because whilst it's not the Himalayas, it's not even Scotland, but it is a nice part of the world to be in, and you can go out, you can practice medicine and just spend your time in the outdoors. And I think that sort of whole expedition ethos and whole expedition medicine idea was a way of kind of blending those two passions of medicine and the outdoors, and then seeing where it takes me, really.
So what was your first plunge? What was your first expedition job?
Yeah, so thinking back to that, so I started, like a lot of people, by sort of working on events in the UK just to get used to the whole idea of what being outside of a GP surgery or a hospital was like. And then my first sort of main overseas job was with youth development. So it was with an organisation called the British Exploring Society, they're an excellent organisation. That they essentially take young people who wouldn't necessarily otherwise have the opportunity into sort of the great outdoors, sometimes in the UK, but the expedition I joined was out in the Canadian Yukon, which is like Scotland but on steroids. It was a great place. So we lived there in tents for, I think, 4 or 5 weeks. I was sort of the main doctor there, and a lot of it is GP work. It's a lot of primary care. You obviously have to better manage emergencies and trauma if things happen, but so much of it is the planning, is the sort of day to day. What happens in normal life also happens on expedition. You just have to be prepared for a few other bits as well. So that was the first job, and actually that was fantastic, being able to see people from multiple walks of life all sort of come together in the outdoors and then leave as if they'd known each other forever after that month. And that particular organisation, it's really worth anyone listening sort of getting involved with, because they have a really good ethos in terms of increasing opportunities for people who might not otherwise get those chances.
So you did that job without a expedition medicine program or train up or master's degree, and you've changed that, haven't you? You've been part of the push to have an academic program in expedition medicine.
Yeah, so I think at that point, I'm trying to get my timelines right. So at some point, I have done a diploma in expedition medicine from the Royal College of Physicians and Surgeons up in Glasgow. I think I may have just come to the end of it before doing that expedition. I'm not sure, but it's a really interesting one, and it's a really interesting topic to think about, because compared to, say, the Royal College of General Practitioners or the Royal College of Physicians, in various different countries, there's not, at least in the UK, there's not really a recognised framework to hang expedition and wilderness medicine. It sort of exists in a few different areas, and lots of courses exist, but it's not like there's a framework as such, which is quite interesting. I think that there probably will be within the next few years. I think that's where we probably need to head collectively, because you have lots of practitioners and then you have the industry that we work for. And is there a complete understanding between them? I'm not sure. And I think having some sort of framework is probably quite useful. I'm not sure where that will come from though. But it's an interesting thing to sort of put out there.
So is that something you would like to work towards? What would be a perfect world where you could design this framework? What future do you see to have this academic expedition medicine in place?
I think the trouble with a lot of expedition medicine and sort of some of the opportunities is, I think that a lot of companies will sometimes advertise for an expedition medic in inverted commas, and I'm a doctor, fine, but doctors can do these roles, nurses can, paramedics can, and that's great. I think the difficulty is that there's often a lot of expectations potentially placed on that individual clinician, and the company doesn't necessarily know what that clinician can and can't do. So it's an understanding both from the company of what that clinician can do, but also that clinician is also putting themselves potentially in a position of vulnerability with that company. And I think having some academic standing or some framework or portfolio or something like that shows, okay, I can do X, Y, Z skill in this kind of environment, and therefore I'm suitable to be your medic in this particular environment, I think would be quite beneficial for both companies when they're looking at sort of insurance and things like that, but also for medics as well. And it's another sort of big debate within this whole industry is the topic of paying staff who then work on these expeditions, because often and it's no secret that it's a challenge to sometimes be remunerated for some of these things that we do, and I think that potentially goes hand in hand with being able to illustrate your abilities and things like that as well. So I think they're all probably quite interrelated, but I I think that's probably something that would be nice to happen if it could, moving forwards in the future and things.
Would that be a variance of what the Faculty of Pre-Hospital Care do with the Royal College of Surgeons of Edinburgh?
I think it's a similar sort of idea. Yeah, I think expedition medicine has maybe not quite found its home yet, but I think there is obviously that document that was produced a few years ago by the Faculty of Pre-Hospital Care looking at expedition medicine specifically, and I think that's definitely was a step in the right direction in terms of having some sort of framework that people can then look at and then sort of work towards and think, because it's also doing a bit of a personal risk assessment. That's something I always do. I'll look at something and say, okay, yes, I'm a GP. I do some expedition medicine. Yes, actually, I'm looking at this particular expedition. I don't feel that I have loads of experience in whatever that terrain is or that environment, for example, because I think you have to be careful. It's working out, the opportunity looks great from whatever you've been sent, but then I always do this thing, which I call it the Daily Mail test. Are you getting yourself into something where actually this may all be great on the surface, but I think maybe I'm too cynical, but you always need to have a bit of scrutiny underneath as well.
So you and I met a fortnight ago here in Malta on the Medicine and Mediterranean Conference, and you had a presentation. So tell us about that experience and what did you present?
That was great. It was only 2 weeks ago. Time flies, doesn't it? Yeah, so that was great to be part on. So yeah, I gave a talk on human factors, specifically looking at pre-hospital care. And I guess some of that comes from my experiences working a lot of it on expeditions actually, but also in some of the roles I mentioned earlier. And it's interesting because you can plan to the nth degree with all your your medical kit and all of these things, but if you fail to address the team or those other humans that you're going to be with, that I'm sure people listening will be familiar, but that can make or break your experience, particularly if you're having to be with people for a long time in an austere environment. The last thing you want to do is sort of set off on the wrong foot, which can be quite tricky.
Yeah, it was great to see that. And would you think about doing it again or doing another presentation next year?
Yeah, for sure. I think the nice thing about the conference was obviously, it was great to do a presentation, but also so many other fascinating speakers as well, and the chance to network and things, particularly with the people who were exhibiting at the back as well. Actually, we're getting one of the devices to test with the local mountain rescue team, so that will be really good. So definitely keen to sort of stay involved in that. It was a real fun conference, and the fact that it's in Malta makes it a good idea as well, because it's a little bit warmer than Wales and a bit drier.
We were a bit cheeky on doing that, having a conference in the dead of winter in a place that gives a bit of respite from the snow you'll see in Wales.
Yeah, I mean, we tend to not even get snow would be good. We tend to just get rain. It just rains. It's always wet. But then when it's sunny, it's beautiful. So I can't complain. Wales is good.
Right. So you also do wilderness work with the Brecon Beacon Mountain Rescue Team. How is that for you? What is that like?
So the mountain rescue team is a relatively new thing for me. So I am a probationary member at the moment. So I've completed just around a year's worth of training, which is important because for me, I actually want, whilst I am technically a doctor, obviously within the team as well, the great thing about mountain rescue is that we have lots of CAS carers. So they used to be called CAS carers. They're now called remote rescue medical technicians. It's just a renaming. But the nice thing about that is there are lots of people who can assess casualties, because what I want to do is kind of distance myself from the medicine for a little bit to get all the technical skills. So part of the reason I wanted to get involved with mountain rescue was because it means that I can kind of scratch that wilderness medicine itch a little bit without having to travel too far around the world, in that it's on my doorstep. Because I think that's always the challenge. So I've got a 3-year-old son, and each time I go on a longer trip, it can be difficult. So part of the logic behind that was to try and do a bit more stuff domestically at home and things, but also to develop some more of those kind of rope rescue skills, some of those technical skills that I didn't have. And it's been great. So the learning curve was very steep. So I'm not a climber. I don't come from sort of a climbing background, so that there was a lot to learn. But yeah, I've been on the call out list since sort of November and things now. So that's good. It's always interesting going out on a job, seeing what's happening and things. So yeah, that's been something that I'm really pleased about, and I look forward to seeing how that kind of develops, as I'm very early on in that sort of part of that work at the moment.
So Daniel, you're also part of the mountain rescue. So you tell us about that. How's that experience for you? What are some interesting call-outs you had?
Yeah, so the mountain rescue has been, as I was saying, it's been a fairly new role for me. I think that the most interesting call-outs are probably, we tend to see a mixture of things. Often it is disorientated, cold people who've maybe not planned their day quite right, or they've had an injury and now they're stuck and the mist is starting to come in and things like that. We do have people who maybe have slightly more significant trauma, so head injuries, limb injuries, things like that. And that's when you have to, make sure your fitness is okay, because you're carrying your rucksack, you're carrying the metal stretcher, the wheel, lots of other kit up to try and then bring them back down again. That's not necessarily fun. It's actually quite hard work going uphill and things. But I guess the fun is in the reward when you're handing over that patient to the ambulance service. You're back at the control or at base, having a cup of tea, having a debrief and things, and that sort of makes it worthwhile. Sometimes, when it's really cold or you're woken up in the middle of the night, that's a bit more of a challenge. But so far I'm really enjoying it and looking forward to seeing where that journey takes me.
I'm curious about the medical training that the non-doctors have. So do you teach a wilderness first responder, or let's see, in the UK it's remote emergency care, isn't it? What kind of training are you giving to your teammates?
So there's a few different levels. So all of the team will do various medical competencies, so basic life support, how to use medical gases like oxygen and nitrous oxide, at least knowing how to, where they're stored and things like that. And then the step up from that used to be called the CAS Care exam. It's now called RRMT, which is the Remote Rescue Medical Technician. And essentially it's a syllabus set up by Mountain Rescue England and Wales. And people who want to sort of increase their skill set end up they do an intense weekend of training, which goes through essentially lots of medicine and trauma. So how to do a primary survey, various different medications as well, because once you have that additional training, you're able to give medications under a PGD. And once you've done all that training, you then have to do there's a written exam, and then there's like a practical OSCE exam. And then if you pass that, you're someone who is going to be sort of well placed to assess a casualty. The nice thing within our team is, so our team leader he's a GP as well. There's myself as a doctor, and there's a few different paramedics as well. So there's sort of more top cover. It's not like there's going to be someone completely alone. But that being said, if one of the CAS carers or RRMTs does want to assess a patient and needs to administer medications, then there is a mountain rescue formulary as well, which essentially it will have a list of indications, contraindications, and it's fairly foolproof in terms of, if A has happened, you can give B and things like that. So really good, actually, and it's a really nice system.
How long is the RRMT course?
It's a weekend as far as I'm aware. I haven't been involved in teaching that myself yet, but I know we've got one locally coming up fairly soon, so I suspect I will end up helping with that one a little bit.
Nice. And what are your plans for mountain rescue? Is this something you're going to be involved in? Do you want to kind of steer the future of the medicine part of mountain rescue?
So that's a really good question. I think for me at the moment, it's a case of just getting embedded in the team as it's sort of early days. There's a good medical team within Mountain Rescue England and Wales as well. Any opportunity to learn from them and get involved is always a good one. But yeah, I think at the moment it's just sort of getting my feet stuck in, getting going and things. There is an annual conference, so I'm looking forward to going to the next one of those, and we'll see what kind of comes out of that.
So I noticed you have your DTMH. As an avid fan of tropical medicine, in fact, I'm here in Malta teaching tropical medicine again for our bachelor's degree paramedic students. You have your DTMH, your Diploma of Tropical Medicine and Hygiene from Liverpool. So tell us about that. What is your interest in tropical medicine, and how was the program in Liverpool?
Yeah, so that seems like a really long time ago. So that I ended up doing that just as the pandemic was happening. They sort of merged a bit. So it was an interesting place to be, obviously, discussing tropical diseases as COVID emerged and things. But so the reason I ended up doing that, first off, Liverpool is a great place to study and a great place to live as well. And fantastic lectures. Really enjoyed the diploma. It is a lot of information, though, for 3 months to take in. But no, that was a fantastic experience. So the reason I sort of got involved in that was, there were a few reasons. So I think when I did the expedition medicine diploma, that was a great course as well. But it sort of whetted my appetite to lots of different areas of medicine that maybe, you definitely didn't get through GP training, and one of which was tropical medicine. And we were lucky enough to have some lectures from David Worrell. I don't know if you know him, but he's obviously fairly eminent in terms of tropical medicine. And I think then I thought, I'd like to find out a bit more. So I applied to do the DTMH in Liverpool. And one of the reasons I wanted to do that was because personal interest. Also, for sort of expedition work, it's quite useful to have some of that knowledge. I was also starting a travel medicine job, so it was quite helpful to know that, particularly if you're having to consult with people who are kind of coming back from overseas. And then the other reason is that it linked in quite well with another role that I have, which is a voluntary role, but so I'm the medical director for a telemedical charity called the Virtual Doctors, which is essentially connects UK doctors with clinicians in Zambia and Malawi, and we give telemedical advice. So understanding and having an appreciation of the kinds of conditions that can present over there and might get referred to us was quite important, particularly as the sort of medical director as well. And so a few different reasons in terms of why I wanted to study that. But it's a great place to be, particularly the Snake Lab, which is a crazy place. But yeah, really, really good.
So you've been down to Zambia and Malawi?
Yeah, so not Malawi, but we were recently in Zambia. So I organised an expedition last year called the Livingstone Revisited Expedition, which was generously supported by the Scientific Exploration Society. And we essentially spent 3 weeks out there. It was an overlanding expedition travelling around 3,500 kilometres around Zambia. And what we were doing was building on the telemedicine that we do already, and essentially onboarding more clinics and also distributing solar lanterns, because there were significant issues with power outages and lighting in clinics. So the telemedicine we do, it's not like what we're doing now. It's all text-based and asynchronous using an Android app on a phone. So what we were able to do was essentially travel around, linking with different district health officers and linking with different clinicians and onboard those. It's fantastic. Great to go to Zambia. It's a really lovely country, really welcoming people. We were also able to onboard 60 new facilities, which is essentially similar to giving 60 new communities access to consultant level advice, which was really beneficial.
That's a fantastic program where these guys now have access to a consultant doctor.
Yeah, exactly. So they can talk to GPs, infectious disease specialists, pediatrics, obs and gynae, whatever they need advice about. But importantly, the idea is that whilst they will send a case, then hopefully they also learn about it and don't necessarily need to ask us in the future. So the emphasis is on capacity building, and also, whilst it's great that someone like me can answer those cases and I can put my DTMH into practice, long term, actually, we want it to be the sort of telemedical platform within Zambia and Malawi that local physicians are able to use, or local nurses. So it's great that we're sort of babysitting it, if you like, at the moment. But if the Ministry of Health asked us to give it to them tomorrow, for example, we'd say, yes, please have it. And we've always been working sort of alongside them. But yeah, it's a really, really rewarding charity to be involved in. And the Zambia expedition was particularly exciting as well, yeah.
Do you have plans to return and do Malawi as well?
Yeah, we will do so. The good thing is that the charity does have a team in Zambia, so they're obviously a bit nearer than me to Malawi, because we always have to look at it from a sustainability, carbon footprint, environmental perspective and things. But I suspect we will. We will go if we think we can achieve a lot in a short amount of time that we couldn't otherwise achieve remotely. I think we just always have to have that kind of discussion with ourselves. But yeah, if the opportunity presents and it feels like it's the right thing to do, then for sure, yeah.
So I'm curious, where would you say that your favorite place that you've deployed to as an expedition doctor?
Oh, that's an interesting one. So it would probably have to be the Yukon again, but this time in the winter. So was it two years or so ago? I was lucky enough to go and work on the Montane Yukon Arctic Ultramarathon, which it's just come to an end this year as well. It gets quite cold, down to sort of minus 30, minus 40, and there's potential hypothermia, frostbite, things like that. We were actually relatively okay when we went, but just I think some of the reasons people get into expedition medicine is to go to cool places, and that was cool both literally and metaphorically. It was such an awesome landscape to be part of, and a cool event as well. I think bivvying out in those kind of temperatures, just seeing what's going on, that was really good. Zambia, that I was just talking about, was also fantastic, and I've also been lucky to do a bit of TV work over in Fiji as well. So lots of places where you can't really complain that you've ended up there.
So you saw the Northern Lights? Yeah,
we got the Northern Lights. Nice fond memory, just bivvying out, looking at the Northern Lights, thinking, how have I ended up here? This isn't my GP surgery. But that worked out okay.
So, Dr. Grace, my final question for you is this. What advice do you have for the new doctor, the new nurse, the new paramedic who is just starting out in their career in expedition medicine?
I think my best piece of advice would be to always say yes to an opportunity, even if it's not one that seems like it might be the one you necessarily want just then. And because saying yes to one opportunity often has the habit of leading to another one. And if you say yes to enough of them, you go on this sort of little journey, but you often end up in a pretty cool place. I think that's probably what I've been doing over the last few years, and I think that's what I would suggest. Keep doing.
So never close a door.
I think that's it, because you never know what's behind that door or the one after that.
That's good advice, and I definitely appreciate you coming down to our conference, and I'm looking forward to seeing you again presenting at our conference next year. And I'm also interested in and follow you on LinkedIn and social media, and it's fantastic what you're getting into.
Thanks so much. It's been great to chat, and I look forward to seeing you again in Malta.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.